Okay, so now it's time for me to introduce our first afternoon speaker, Dr. Logan Frank. And again, I would just want to add a couple of personal notes to Dr. Frank. So Dr. Frank is from the University of Nebraska Medical Center. He's one of my peers, and he's a strong supporter of pharmacy technicians. He speaks on professionalism on a regular basis to technician students. So he traveled here from Omaha. He's newly married, and so he's taking time away from his new wife to be here with us today because he really supports what we do as technicians. And so, again, you can read the detailed biography of Dr. Frank on your program, and maybe he'll speak to that. So please help me in welcoming Dr. Frank.
Thank you, Judy. Can everybody hear me all right? Yeah, okay. I talk fairly loud, so we'll kind of go through this today. Say again? Okay. You can hear me better now? All right. Well, so today we're going to go through a bunch of different things on OTC medications. Keep in mind, if you guys have any questions throughout, please raise your hand. You can stop me. We can kind of have a conversation. It doesn't have to just be a normal lecture format today. And then this presentation will kind of end with a little fun game. But as Judy said, I am a clinical assistant professor at UNMC College of Pharmacy. So I teach the pharmacy students that are on campus a lot of different areas. Nutrition is a big side. I do some OTCs with the GI system and some different lectures like adherence and things like that throughout the curriculum. Take them on rotations, and I work in primary practice. So in a clinic, managing diabetes, hypertension for the most part. So yeah, let's get started. Today, OTC medications, the good, the bad, and the ugly. So I first want to start out with disclosures, no financial disclosures. I will be using a lot of brand name medications throughout this presentation, just as commonality. Everybody knows the brand name medications a lot easier, and then some of the nuances within what we're going through will be from that. Objectives today, we're going to identify common over-the-counter medications, describe the use of certain over-the-counter medications, and then examine problematic uses and names and how to evaluate that with a pharmacist. So first, defining over-the-counter medications. So I guess first thing I wanted to ask the group is, raise your hand, who works in community pharmacy? Okay, how about inpatient? Okay, managed care? I only saw about half the room raise their hands, so. Well, yeah, so a lot of this will be more over-the-counter community setting. But over-the-counter medications is just medications bought without prescriptions. So over-the-counter at a normal community pharmacy is usually what we think of. They are safe and effective for use when you follow the directions on the box. So if you're not following the directions on the box, taking more or less of a certain medication, there's not a whole lot of evidence to support that use. And for the purpose of this presentation, I am going to be saying the bad, quote unquote. Know that these medications aren't necessarily bad. It's just there's better options, or there is not as much evidence for those medications. Better alternatives are out there. But with patient-specific parameters, you can use those in different cases. So the sections we're going to go over today here, we've got a laundry list here, but normal sections you see in any pharmacy, any community pharmacy. So first one here, allergies and sinus. So you also can term this as allergic rhinitis. So basically your seasonal allergies. Things that usually cause this is pollen in the air. So this time of the year, you can see a lot of that. Seasonal allergies is rampant. The symptoms of allergies is usually your runny nose, your nasal drainage in the back of the throat, headache, sneezing, itchy, red eyes, things like that. So when patients come in to the pharmacy, the good treatments for allergies. These are our 3 antihistamines. They're second generation antihistamines. So we have the Claritin, Zyrtec, and Allegra. So very common medications, very good for allergies. They relieve a lot of those symptoms we just talked about with minimal side effects. Cetirizine is usually the one we think of the most as having some drowsiness, but otherwise there's not a whole lot of side effects to these. So good ones to recommend with patients. Second one here, allergy and sinus treatment. For the good, we have more topical options. So if you do have that red eyes, itchy eyes, using something like Zatador, is that antihistamine kind of in an eye drop. So good medication there, as well as a nasal spray like Flonase or Nasacort. Those have just recently, I'd say in the last couple of years, went over the counter, but those do work almost as well as the tablets do. A lot of times we use the tablets because patients don't usually like to spray things up their nose, but it is a good option for use. Noting that the last one there, the Afrin, this is another one that's over the counter. You're only supposed to use Afrin a couple days in a row. So one of those medications that we don't want to use on a daily basis as it doesn't work as well after a few days. So now the bad for allergies. The first generation antihistamines, so a big one that we all should know is Benadryl, so diphenhydramine. The reason we say it's bad is because it has more side effects. It works for allergies, but it causes so much drowsiness that are you putting the patient asleep or are you actually helping their allergy symptoms? So one we don't use a whole lot, but it is a very good medication if you do have an allergic reaction. So if you take a medication and you have hives or you have tongue swelling, something like that, Benadryl is a really good use in that regard. A couple other that have similar side effects is the doxylamine and chlorpheniramine. These medications are also in a lot of combination products, so do watch out for those, especially for those side effects. And the last one here for the bad is home remedies. We all know everybody has their own concoction, special concoction that they think will help allergies or help a wide range of things. Most of the time in this presentation, I'll say those are the bad because there's not much evidence, but never tell a patient they can't try it. If they think it's going to work, a lot of times that placebo effect, that effect that they're just believing it'll work, really helps out. And the ugly. So the ugly part of allergies is brand name medications. So brand name medications, as we know, is just as effective as a generic, but 2, 3, 4 times as expensive. So staying away from those if we don't need to. Brand confusion. So Afrin, for example, a medication that's over the counter, and there's probably 10 to 15 different products of Afrin. So what's actually in them? Like it has the brand name medication, but what's in it? So reading the back of the box and actually telling a patient what it is, a lot of times it's the same medication. They just brand it different ways, so they get people to buy different ones for really no more use. And then the last one here is combination products. So the picture here, Claritin D. So this has loratadine and pseudoephedrine in it. So it's an antihistamine with a decongestant. So antihistamines usually, like we said, they're good for allergy. It's usually when you have that runny nose, it kind of clogs you up a little bit. But then you put it with pseudoephedrine, and that's going to make you run. It's going to clear out. It's going to decongest you. So combination products can sometimes be a catch-22 where it's helping and also hurting at the same time. So knowing what's in the medication is important. Combination products also commonly use pain relievers or expectorants as well. Next disease state here or symptom is constipation. So first defining it, what everybody thinks of is just infrequent passage of stool. So we don't stool very often, we're constipated. Well, it can also mean straining while stooling. So we're pushing very hard. Or after you stool, you don't feel completely relieved, that incomplete defecation. Keeping those in mind that constipation a lot of times just means you have a different bowel habit than what's normal for a patient. The drug of choice, laxatives, as we would guess, can help the patient use the restroom. There's lots of good laxatives out there, but to distinguish the differences, we like to break them down into the slow, mediate, and high transit time. So basically how quickly they work. The slow ones here, Miralax. That's the polyethylene glycol, the powder that we put in water or a juice and drink. Very good medication, works very well. Same thing with Docusate, but these take a long time. We're talking maybe 3 days to actually have relief of that constipation. So if a patient's coming in and they've been constipated for 3 days already, probably not a best choice for recommendation. So that's where we kind of go in that moderate category. These are the ones that we usually think of as laxatives, quote unquote. So bisacodyl and senna, these are the ones that you get a little more immediate relief. We're talking like 6 to 12 hours usually. And they do have good evidence and they work very well. But that leads kind of into the bad part of it. That second point there, overusing laxatives. So if we use these laxatives on a daily basis, the moderate ones, your body gets used to having something help it along. So if you come off a laxative, your body may not go back into doing its own stooling very often. So we don't want to be dependent on laxatives. Mineral oil is another one over the counter. Not a very good medication because it can cause bleeding. It can have some vitamin deficiencies because of its use. So it can also have that oily sensation when you use the restroom as well. So very bad side effects, not as good as using those ones we talked about already. And the last bad part is, as we talked about, if there is, you need to stool sooner using something that's a little more fast or moderate acting instead of a slow acting. And then the ugly. So with constipation, the ugly is things that work a little too fast. So we got our Melcomag or suppositories or enemas. They work very well, but still have to watch out when you use them. All right, so next one here is cough and cold. So cough and cold, these symptoms are very similar to allergy symptoms, as you'll see. Sore throat, congestion, body aches, sneezing. A lot of times we think of allergies and the common cold as very similar disease states, but allergies we usually attribute to the pollen or to the seasonal changes. The cold is kind of a catch-all if we don't know what's causing their symptoms. So good treatment for this. Specifically, this is for the cough part of it. Delsum, so dextromethorphan, works very good as a cough suppressant, but also just cough drops. As long as they have menthol in them, it kind of soothes the throat, keeps you from hacking up too much. A lot of times we think of using cough suppressants in patients that have a cough that is non-productive. So they're not coughing anything up. It's more just annoying cough. A lot of times when a patient is actually coughing things up, that means there's stuff in their lungs that they need to get rid of. So suppressing that's not always the best treatment. Other ones here, I touched on the Sudafed. Does anybody know the difference between the first two Sudafeds? We got phenylephrine and pseudoephedrine. Has everybody noticed? Yep, so one's behind the counter, still can get over the counter, quote unquote, but it is behind the counter, so you have to go up and use your ID. That's the second one there, the pseudoephedrine. And that one actually does work better. That's why we have it behind the counter. We have to restrict some of its use, but also it does work better, so it's better when patients get that. Phenylephrine is over the counter. They can grab it right off the shelf. Both of these, the big side effect is increasing blood pressure. So we don't want everybody to use it all the time. It's more for that use of decongestion right away. And then has anybody used a neti pot before? So neti pots, basically you fill that little pot there with water, and you put some salt packets in it and just rinse out your sinuses. So another good use to kind of clear that cold treatment. So we said the big side effect of the decongestants, specifically the phenyl or Sudafed, is increased blood pressure. So instead, in the bad category is Coricidin. So Coricidin is one of those medications that, has anybody heard you use that instead of Sudafed when you have high blood pressure? So the reason they do is because it doesn't have a decongestant in it. So if we're using it for decongestion, we shouldn't be using Coricidin. Coricidin has an antihistamine, which actually makes you more congested usually, and a pain reliever. So it really has nothing that is actually used to help those symptoms. And it's a brand name medication. So we're paying more money for something that's probably not working. Expectorants, so something like Mucinex or guaifenesin, helps you have more of a productive cough or help get out what you're coughing. Doesn't work super well, but another one of those medications that if a patient's tried everything and wants to try something new, might be a good option. But for this point of the presentation, I'll say it's a bad medication. And the last one here is Zicam. That's basically just zinc. So you're giving a medication to maybe slow down the amount of days that you're having symptoms. Not a whole lot of evidence to support it. Not really immediate relief. But again, if a patient feels like it's worked for them in the past, that would be okay. And the ugly. So Mucinex is the example I wanted to show. So this is only a start of how many products there are for Mucinex over the counter. Brand name medications. So they come in so many different combination products, and we'll name it so many different things that you really got to look at the box and say, what's in that? What medication's actually in there to help my patient? I know I throw Mucinex up there. If you see that second from the left, the one with the pretty color ring, those are 5 different medications in that one product. So you think it can be good, but it also can cause problems or cause unneeded side effects when treating a patient's symptoms. I throw Mucinex up there, but do know like Vicks, Dayquil, NyQuil, or Sudafed, Robitussin. These are also products that have a ton of different combination opportunities that does make it really hard to assess why a patient's taking what they're taking. Heartburn. So I'm sure everybody has had heartburn before. Hopefully no one's experiencing that at 1 o'clock today. But the burning in your chest can last a couple minutes to a couple hours. Like we said, usually it's after eating hot, spicy, salty foods, which is very common for fast foods, those kind of things. So trying to alleviate some of those causes is usually the best thing, but it can end up causing some of these symptoms like difficulty swallowing, insomnia, so hard time falling asleep at night because of that pain. And then if this goes untreated, you actually can develop precancerous cells or changes in the esophagus. So this is a condition that should be relieved one way or the other, with medications or not. As you would guess, antacids is what we use. So the good, here we have the quick relief, Tums, Rolaids, things like that. It's basically just a base. So it's you have too much acid in your stomach, which is causing the heartburn. We give a base or a medication that basically neutralizes it, so it's not as acidic. So it helps relieve that right away. Quick relief, so this is something after you eat. If anybody's experiencing right now, that's what I would give you, Tums. Second one here is Pepcid or famotidine. So we got that relief and prevention aspects. So you can take it after having heartburn, or you can take it before you eat to try to prevent the heartburn from ever happening. I want to point out that there's 2 brand names. So has anybody heard of Zantac? Okay, so Zantac's off the market now for some abnormalities in their product, but Zantac came out with Zantac 360. So instead of using ranitidine, is what the generic was, it's now famotidine. So they use their same brand name, but again, kind of confuse everybody that has known the brand name to rebrand it and continue selling under their name. And the last group here is PPIs, or proton pump inhibitors. We can only use those for prevention. So omeprazole is the common one, Prilosec, that people see. You should be taking that before meals to avoid the use, or to avoid the acid from ever building in the first place. So if we're using it after, like we would Tums, you're really not going to get any relief. The bad, Alka-Seltzer. We know all those commercials of Alka-Seltzer over the years. Really fun to see that bubble up and disappear. But I put this in the bad category because it contains aspirin. So what's the problem with aspirin? Bleeding risk. So we want to watch out for using that too often. But there are now Alka-Seltzer has a ton of different products, so some may not have aspirin. That might be worthwhile. Tagamet, another thing that's kind of like famotidine over the counter. The big difference is Tagamet has a lot more side effects. So it interacts with a lot of the medications, both prescription and non-prescription. So we do want to avoid that one if we can. Some liquids, Mylanta, Maalox are also not the best option in this situation. It also adds simethicone, which is a gas reliever in that product. So once again, things that we don't probably necessarily need. And then usually when we talk about anything, heartburn, indigestion, upset stomach, diarrhea, I won't continue, we're thinking Pepto-Bismol. So I put this in the bad category as well because once again, major are a lot more side effects. You can have dark stools, black tongue, also has subsalicylate, so that's basically aspirin, so it can have that bleeding risk as well. And the ugly, antacid brand names have multiple versions. So you see Tums, there's probably 18 different bottles of Tums over the counter, brand generic, flavor differences, things like that. So it's kind of ugly to see all of those things, and really they have the exact same product in them. There might be an extra strength that has a little bit more, but other than that, there's not a whole lot of difference between them. It's ugly when you're using like a omeprazole to treat acids that's already in your system. So if you're just got done eating, you're taking a PPI, omeprazole, you're not going to get relief. And then a lot of products all work the same. So as we said, a lot of them have the same ingredients, so always being able to look on the bottle. And then a lot of them add even simethicone in there as well for that gas relief. So getting extra products that we don't necessarily need. Pain. If anybody wants to explain to me what pain is, you guys would be very good. Pain is such a very subjective symptom, but if you look up the actual definition, they have this very high level term of unpleasant sensory experience. So a lot of times you just have to trust the patient that they're saying they're going through pain and trying to assess it. Pain can be actual or potential even, so it can be tissue damage or the thought or feeling of tissue damage even if there's not tissue damage. So good ones, these are the products that we see so often over the counter. We got Tylenol, Motrin, Aleve. These three medications are probably the most popular oral medications that we use. The nice thing is that these also help fevers. So when patients aren't feeling good, you take these and then it'll reduce that fever. It's also the reason that Tylenol, yeah, go ahead. Yeah, so the question... Yeah, that was a good question. So the question was the long-term use of ibuprofen, like what's too long, how long should we be using it? I would say if you're talking with a patient, the big thing is just the less amount of time, the better. So it does interact with other medications. Ibuprofen specifically can have some bleeding side effects, can hurt your kidneys and your heart. So it's hard to say like yes or no of how much, because if that's relieving pain and without it, you're not getting relief of pain, there's worse medications that we might go to. So it kind of has to be a conversation with the physician or with the pharmacist to kind of figure out what's good for that patient. If we have a 25-year-old patient that's coming in and doing ibuprofen pretty continuously, that's a lot better than a 70-year-old patient doing the same. So it's all going to be kind of wishy-washy on that. But I would answer that question by just saying the shortest amount of time as you're able. Try to figure out what's causing the pain and deal with that problem instead of putting a Band-Aid on it with a pain reliever. Good question. But this is also the reason that they put acetaminophen in a lot of our over-the-counter medications, because it does have that pain relief, so it makes patients maybe feel better and also reduces fever, which is also a thing that we usually want to treat. Over-the-counter, we also have creams and patches, so topical formulations, Voltaren, capsaicin, lidocaine, those are the products, but there's numerous products out there that contain these, so I couldn't really put in very good brand name medications. The bad anything with aspirin. As we've hit on a couple times, aspirin does have bleeding side effects. And if you're using it for pain relief, we have to use really high doses. So it's not just the low dose aspirin, the 81 milligram aspirin is not going to help with pain relief. We have to get hundreds up to thousands of milligrams to get that pain relief. So that's increasing that risk of bleeding even more. Second one here is Tiger Balm, Biofreeze, Aspercreme. All of these things basically have camphor and menthol in it. So it's more of distracting from the pain, not really giving a whole lot of pain relief. They do work, especially in like muscle aches. That can be relieving and soothing. But for strictly pain, probably not the best product out there. And the last thing is kind of what we were talking about already with the question, is taking too many tablets. So it's bad to overdo on acetaminophen or overdo on ibuprofen or naproxen because you can have those side effects that are relevant. One of the biggest mistakes that patients think is if it's over the counter, they can take it. There's no side effects. We can take as much as you want. So making sure that patients know there is consequences to their use. And the ugly. Brand name medications, once again, sticking to those generics if we can to save the patient the expense. The options. If we're talking topical products, there is so many that have lidocaine and that menthol in it. So many different products that it's hard and ugly to figure out which one you want to use. I would say as a pharmacy, you'd find which one is the cheapest and have that as your recommendation for patients. And combination products. So acetaminophen is the one that we see in about every over-the-counter product you see. Any combination product the probably first ingredient they put in is likely acetaminophen. Acetaminophen does work well at pain relief, does work well at fever reduction, but we can't have too much. Does anybody know how much is the max a patient should have in a day? 4 grams. And a lot of times when it's over the counter, we say 3 grams, just to make sure that patients don't use too much. So 4 grams. Well, have you guys ever had to try to tell a patient how much is 4 grams? Yeah. So making sure patients are sticking away from those combination products to avoid that overdose. And I guess I didn't ask, so why are we limiting it to 4 grams? Liver damage. Yep, good. All right, insomnia. I'm assuming we're not dealing with insomnia right now. It's probably the other way around. But symptoms from insomnia, we usually think about difficulty falling asleep, but it's also the fact of difficulty staying asleep and having daytime sleepiness, which could be one of those symptoms right now. With insomnia, before we go into medications, we usually like to talk about sleep hygiene. Realistically, there's not a lot of medications for insomnia, especially over the counter. But doing things like not using your phone before bed or being in a cool room, dark room, things like that will actually help a lot more than medications. So as long as patients are taking care of those things, we'll kind of help them out. But the ones that we do have that are good over the counter is ZQuil. Take note that it is ZQuil, not NyQuil, much different, which is another point of confusion. But this basically has diphenhydramine in it. So Benadryl is all we're giving the patient. So like we said, Benadryl is not great for allergies, but can be good to put patients to sleep because of that side effect. Or in this case, that's the reason we're using it, so why we're using the product. Unisom, another first generation antihistamine that we talked about in the allergy system. And then melatonin. All 3 products are decent products that can help patients go to sleep and stay asleep. The bad, the herbal supplements, home remedies. We definitely don't want to use alcohol, those kind of things. You'd be surprised what you come up with. Always focus on that sleep hygiene. And then the ugly, again, brand name medications in combinations with acetaminophen. So I put Dayquil, NyQuil in there because a lot of times that gets confused with ZQuil. We attribute both of those things to going to bed, but they may or may not have that diphenhydramine in it in the NyQuil. And as this picture here shows that there's 2 different products for NyQuil that have 2 different ingredients in them. So being aware of what's actually in it. Yes?
What's the biggest difference between ZQuil and just taking a Benadryl?
Yeah, so that's a very good question. What's the difference between ZQuil and just taking a Benadryl? So the biggest difference would be a liquid sometimes hits you a little bit quicker than a tablet. But honestly, I think I've done this maybe once in my life of having insomnia, I would buy the tablet and just take a little. Yeah, because I mean the tablet, you can pay like 88 cents for a box of 20, or you could get ZQuil that has maybe 5 doses in it for $10. So yeah, you just may need to take it a little bit sooner in the night. Good question. And last one here, we got vitamins, minerals, and herbals. So I didn't do a good, the bad, and the ugly on this because at the end of the day, they are good products. Most of the products can work, but just realizing that not everybody needs a multivitamin. So if you're eating well, you're eating a balanced diet, you shouldn't need to supplement. That is why these are called supplements, vitamins, minerals, and herbals. Your foods that you're eating should have all of these vitamins to the amount that you need. If you are low in something, that's where it's fine to supplement. So we think of things like elderly, using the calcium, vitamin D, very good use. Pregnancy could use folic acid. So those are times that we do want to get some extra in your diet. But you may simply need to just do a multivitamin. So if you're looking at a product and you want folic acid, well, is the folic acid more expensive than just doing a once-a-day multivitamin that has the same amount of folic acid but gives you other things as well? Possibly. So figuring out which one you actually want. I wouldn't be too worried about overdosing on vitamins and minerals. A lot of times in school, we call that expensive urine. So it's the way you want to go. Did you have a question? Yes.
Yeah, my cousin and I were discussing over July.
Mm-hmm.
There's prescriptions that are pulling the potassium out. And it was my kidney stone doctor that said your potassium bottomed out.
Mm-hmm.
So I don't think doctors are addressing the diuretics.
Yeah, so what I'm hearing is that you have a medication that's diuretic that's causing your potassium to be out, and then trying to think of what to use to bring it back up.
I take potassium.
You take potassium, yeah.
Because I'm not, my potassium bottoms out, I'm nauseated, and then I don't eat.
Mm-hmm. Yeah, and that's always that's the hard thing, is like that catch-22 of like, we may need it to get fluid off, but we also are losing potassium. So it's one of those things that a lot of times you'll need a medication like that, either potassium supplement or something like the combination products for prescription. So like a Miloride or something like that is in the product that will keep that potassium a little bit higher. But only certain ones have it. So yeah, that is a good point though of potassium in general. We think of potassium as you can buy in the over-the-counter herbal section, or there's prescription potassium. If a patient has a prescription for potassium, always use the prescription because the amount of potassium in it is so much greater in the prescription that you're just getting more bang for your buck. So overall here, we got the good OTC treatments, overall generics, single product or single ingredient products. So only has one ingredient in it, like Benadryl. It's not Benadryl with another antihistamine or something like that. It's single products. And the good are the ones that are safe and effective for appropriate use. So once again, as long as you do what's on the labeling, great to use. Yes?
So that safe and effective, you said potassium prescription, potassium.
Over the counter, like in the herbals. Yep.
Does that imply that prescription is also FDA approved?
Yes, prescription is FDA approved. Yep. The herbals that are over the counter, they just have a lot less quantity in them. So, and it's hard because I think it's usually milligrams over the counter and it's milliequivalents as prescriptions. So comparing the two makes it hard for patients. Yeah. Good question. OTC treatments, the bad, once again, home remedies for the most part. Feel free to use them, but it's hard to recommend them as a healthcare professional. medications without great evidence, and medications that have more side effects. The ugly, brand name medications. Oftentimes they're very misleading. You don't really know what's in them unless you turn the box over and have the knowledge base to read a prescription label. More expensive, many products, and they may have just the same ingredient. They're just branded differently. And they may state day or night, but what's actually in the product is the exact same. So they have you buy a day and a night, but they really have the same thing. They put a different label on it and sold it for you for more money. Combination products, and the example, like we talked about, the antihistamine with a decongestant. That's Sudafed, Sudafed D, Claritin D, things like that. And then combination products that have acetaminophen. So getting that too much acetaminophen from taking too many different over-the-counter medications, causing those liver problems. So how should we evaluate with a pharmacist? Some of those general rules of thumb. So making sure, from the pharmacy point of view, making sure you're not making that recommendation straight to the patient and you're talking it over with the pharmacist. But if a patient's asking you this or that over the counter, maybe point them in the direction of avoid combination products. So make sure there's only one ingredient in it. Get them to generic. Be friendly on their pocketbooks. We know how expensive prescription medications are, and if we can help them over the counter, that does help as well. And treat only those symptoms that they need. So find that single ingredient product, get that one instead of giving them something that's going to give them 5 different medications when all they have is a cough. All right, so we're going to do a little Kahoot here as our post quiz. Has anybody used Kahoot before? Let's see if this works here. There we go. All right, so you can join at www.kahoot.it on your phone. And then when you log in, or if, oh, it's not sharing. Let me do this here really quick. Oh, this is what I wanted. There we go. All right, can you guys see that? And if you guys, I don't know if you're going to be able to zoom in that far, but if you guys can scan the QR, that would work as well. Got some people coming in. Good. All right, has anybody done Kahoot before? No. Okay. Say again. Has anybody done this Kahoot before? So when we get a good amount of people, I'll wait for you guys. But what you're doing is going to be, we have 5 questions. And it's speed and correct answers. So you'll read the question. It'll give you a little bit of time. But then the quicker you answer the question correct, the more points you get. If you get it wrong, you don't get the points. So getting the question right is more important than the time. But the fastest will win the game. Is everybody in that wants to be in? Almost. I know technology is good. Want me to wait on anybody else? Yep, okay. All right, we good? Any objections? All right, we're going to get started. All right, here we go. So much pressure. Which medication is mixed with the most OTC products? All right, get your picks in if you haven't. 3, 2, 1. All right, so 23 people got it right. The correct answer is acetaminophen. That's the one we want to watch out with OTC products. So scoreboard, K. I don't know who K is, but K, you're leading. After 1, basically means you got the right answer in the quickest amount of time. All right, number 2. Which medication is used for treating a cough? Three, 2, 1. All right. Delsum, that is the correct answer. Good amount of people are getting it right. That means people paid attention. Thank you, guys. All right. Oh, K's gone. C is up. I don't know what's with these consonants, but we're doing it. All right. So not up by much, but we are still there. Ready for question 3? Which product is most expensive? All right. Good, Allegra. Why is it Allegra? Brand name. Good job. Good job. All right, where are we at now? Uh-oh, C stayed in it. Okay. Oh, C. He's one of the pharmacists in the room. I think that's cheating. Yeah, right? Come on. But Max right behind you. Judy, you should just take his phone. Which medication will not treat current heartburn? Not treat current heartburn. Little more difficult question. All right. Omeprazole, PPI. We want to stay away from those. It has to be prevention. Good, good. All right. Let's see if C got it wrong. Dang it, C. All right. EW is right there, though. Right there. All right. Last question here. 5 of 5. Which product should we avoid recommending? Five seconds left. Oh, not many. Trick question. I have a feeling that C might have got that right. So, but yes. So pointing out that only the pharmacist can recommend. We always want to tack it over with the pharmacist. But if I didn't throw in that curveball, the combination products would be that correct answer. Combination products. I didn't have that as the right answer because there are times where combination products are okay if they have all the symptoms that the medications are treating. But always be careful in recommending those. All right, let's see how it went. Row number 3, 2, I don't know, 4, 4, 7, or okay. And number 1 did K come back? Pookie. That was great. Oh, look, C number 4, sad. Good job, guys. Okay. So just to pull it all back together, I know we did some summary already, but pick OTC products that treat specific symptoms. Be aware of tricky combination products or tricky Kahoot questions, and always seek a pharmacist to discuss those recommendations with. So I'll open up to questions. Yes?
Question about children's use of melatonin.
Yep. So the question is children use of melatonin.
3, 4, and 5.
Yeah, so that gets in. I honestly, off the top of my head, I don't know. I don't know what I would recommend on those patients. A lot of times under 4 years old, we kind of want to avoid over-the-counter medications for children unless it's specifically prescribed from a physician. Also, kids that age usually would hope that you're not having to supplement or give them medications to sleep. That sleep hygiene or that sleep routine might be a better option for those patients. Yeah, good question. Yes.
Ever generic brand specific? Like, do you ever prefer one generic company above others in over-the-counter products?
Yep. So the question was, do I ever keep to one brand of the generic formulations over the others? And I'd say I would go around my pharmacy and find the cheapest one and say, this is the brand or this is the product that I'm going to tell patients that I would recommend. Because at the end of the day, they're all the same medication. It's all been through the approval process with the US FDA. So why does it matter if it's $3 or $1? I just picked the $1 one. Does that answer your question?
Sometimes I'm generic brand specific.
Yep. Is there an example?
Sometimes I like nature-made vitamins,
So like nature-made vitamins, yep.
specific brand of CoQ10. Sometimes I'm fish oil. I don't think I'd pick just any fish oil.
Yeah. And that is a good point. A lot of those herbal things that are over the counter, as I don't know if anybody saw a couple years back, there was an article about whether there was actually the product ingredient in what they were selling. The herbals is a little more loosely monitored compared to like the acetaminophen and those actual products. The herbal wall is always a hard wall to recommend on. But yeah, that would be an example of when the brand maybe matters a little bit more, that they've actually went through and had pre-approval before the product goes on. Yeah. Yes.
My question is, as far as
CBD versus Tylenol. So I have not done any recommendations on CBD. I know that's going to be a hot topic in the next couple of years with continued use and dispensaries, that approval process coming as well. So using between the two, at this point, my comfortability would be with acetaminophen if we're treating that pain. CBD may work. I don't feel I have enough knowledge to recommend that at the time. I don't know if Chris or anybody in the back has any thoughts on that. Okay. I'll go right here.
A trick with the generics.
Yes.
The brands. Like if you're buying a generic at Walgreens isn't making that generic. They're buying it from a friendly company. And if you look where the generic is, whatever brand it's next to, that's who's generally made the product. So
Yep.
if you're looking, let's say you definitely want Tylenol, then you would want the generic that's right next to the Tylenol.
Yep. So, yeah, everybody heard that.
Applies all the way to a grocery store. If you see like the tomato sauce next to Ragu, it's made by Ragu. So.
Yeah. So a lot of times generic products are right next to the brand name product, and oftentimes they may be made by the same person. I think a good example of that is when you see brand name medications go generic. I can't think of one. Maybe Nexium was one that came out. They basically put Nexium tablets or capsules into a bottle that said esomeprazole and sold it. So they didn't make a new product. They just had to put in a different bottle to make it generic now. Yeah. Yes.
Do you have any patients that have problems with the fillers?
With the fillers,
Polyethylene glycol.
specifically polyethylene glycol.
I react to that.
Yeah. So
Get mouth blisters and toothpaste.
yeah.
Certain medications I can't take.
So the question was, are there ever have patients that have trouble with fillers that are in medications? So as we say, the brand and the generic have the same stuff in them. I should properly say it has the same active ingredients. Those fillers or those inactive ingredients is a lot of times where those allergies can come from. So yes, you do see that. That would be a good example of where we use specific brands that we know that the fillers and the ingredients that are in it, there is no effect. But yes, that is a concern. Yep. Did you have a question? Yeah.
What is the deciding factor of why the FDA would move a prescription medication to an OTC drug?
Yeah, that is a very good question. So the question was, how does the FDA decide if a medication can go from prescription only to OTC? I honestly don't know the entire approval process, but it's basically when a medication is safe enough for normal patients to use. So one that I've been waiting for to come OTC is more like a statin medication. There are medications that are similar to statins over the counter and actually contain some of it, but there's always some concerns whether it's taking too much, if that's going to cause harm to a patient, because like we said, patients think when it's over the counter, there's no side effects. So the approval process, I'm not exactly sure with, but it's usually that they can show greater good of using the product and not many side effects if they use too much. Yeah, great question. All right, any other questions? If you guys have any questions, please reach out. Judy has my information, as well as I think you guys are getting these slides. Thank you.